All right, thank you very much for waiting, everybody. We have the seats ready and everybody's here beside the stage. So let's call them in. So please welcome Ken Shibusawa, Scarlett Chen, Saeda Makimoto, and Shigeru Handa on stage. よろしくお願いします. Thank you very much. ありがとうございます. Now let me properly introduce our panels. Our moderator, Ken Shibusawa, is the founder of Shibusawa and Company and chairman of Common Asset Management. Scarlett Chen is managing partner at Verge Health Tech Fund, a VC fund focused on impactful health tech startups. And Saeda Makimoto is Senior Deputy Director General at JICA's Human Development Department, leading global health strategy and initiatives on pandemic preparedness and equitable access to the medical tools. ありがとうございます。すいません。お座りくださいと言わずに失礼いたしました。And Shigeru Handa is a director of AAIC Investment, where he leads African healthcare venture investments and supports startups with expansion and fundraising. Now, before we begin, please welcome Mr. Shima from the Impact Investment Initiative for Global Health. He will introduce their work in the field of universal health coverage before we hear from their panelists. それではShimaさん, please take it from here. お願いします。
Thank you very much for joining today's Triple I session by our co-chair, Mr. Shibusawa, and our Triple I precious partners. This is Ryoichi Shima, Cabinet Secretariat, Government of Japan, and Triple I Secretariat. Japanese government recognizes health as a foundation of development and economic policy and has long promoted health as key area of international cooperation and leading global discussions. The Impact Investment Initiative for Global Health, III, so Triple I in short, is a G7 initiative, was endorsed at the G7 Hiroshima Summit in 2023. At that time, Japan was the chair company of G7 and launched at the United Nations General Assembly in 2023. Let me briefly introduce Triple I before the panel. In many low and middle countries, there are financial burden for health is increasing, especially after COVID-19. To achieve universal health coverage and SDGs, it is difficult to fill the gap, financing gap, only through ODA. So with this background, Triple I was established to promote impact investing, aiming to accelerate private sector funding to global health sector to support achieving in universal health coverage and also SDGs. In these 2 years after launch, Triple I has operated based on 3 pillars. Number 1 pillar, raise awareness of global health. We held Triple I event in international important area like United Nations General Assembly, World Health Summit, World Health Assembly, and Davos World Economic Forum, for example. In these days, before last month, we did a Triple I event in United Nations General Assembly also. And also, we organized a panel at important related summit like this summit to enhance understanding and appreciation of impact investing in the global health. This is the first pillar. And second pillar, support the development of impact measurement and management in global health. We collecting, sharing, and analyzing best practices in IMM, impact measurement and management. Establishing working group to gather expert insights, and recently publishing the IMM practitioner guide and IMM recommendations in General Assembly, UNGA. So, impact measurement and management is very complicated, and especially in ESG, environmental field, it is more advancing. But this social area, especially in general, global health is not matured. So we'd like to keep contributing for harmonizing the IMM for global health area. And also, third pillar is strengthening incentives to promote impact investing. Since impact investing in the health sector in LMICs carries high risk, so it is essential to build an ecosystem with government, developed financing institutions, and other relevant organizations. In this field, also we gather a world working group and established recommendation for making enabling environment in this Davos. Through these activities, we can raise awareness for this area, global health for impact investment. And the partner number is from 37 at the launch, but right now we have 115 precious partners. We appreciate for every triple partners like these members. And this helps strengthening collaboration among partners, we think. But given the increasingly challenged landscape this year, especially surrounding global health and health financing, the role of III for GH is becoming even more critical, we think. So III will contribute to support the promotion of impact investment in the global health, we think. We hope we'd like to commit it. Thank you very much for a brief introduction for III. Thank you very much.
します。ありがとうございます。Thank you very much. All right, so Mr. Shibusawa, the floor is all yours. お願いします。
Okay, thank you very much. Good morning, everybody. Thank you very much for joining our session. Before we get rolling, I'm trying to figure out who are the audience. What are your interests? You're interested in the health sector. Please raise your hand. Okay, thank you. Specifically in global health. A little bit, thank you. How about impact investing? Okay, others? No others. Okay, good. So we got a very focused audience. That's wonderful. So my name is Ken Shibusawa, and I'm one of the co-chairs of III, joined by Ms. Yodi Alakija from Nigeria and Mr. Steve Davis from the United States. And we've been trying to mobilize private sector capital into global health as an investment, not just aid. And I said it in one short word, but it's actually quite a challenge, but a very meaningful challenge. Even now, we started this initiative in 2023, and now in 2025, it's even more pertinent, I believe, in the world today. Today, we are joined by a prestigious our III partners, who makes it all possible to do this. We're not a fund, and it's basically a network, and it's all the financing is actually from the Japanese government. So thank you very much for the Japanese government for sponsoring this network. But wanted to go straight into self-introduction for our distinguished guests. First, Miss Scarlett Chen from Hong Kong, Verge Health Tech Fund. Just maybe a short 1-2 minute self-intro.
Sure. Scarlett Chen, Managing Partner at Verge Health Tech Fund. Verge is an early-stage VC fund that focuses on global healthcare technology companies. And our 33 investments have now impacted more than 25 million lives globally. And we are a fund that focuses on delivering 2 different bottom lines. So the first one is financial returns, no surprise. And the second one is really impact. And we are supported by impact capital, corporates, as well as also financial institutions, which are supporters and funders in the fund. And Another one to remark is that we are not a typical healthcare fund. We are actually a tech fund in the healthcare space. So consider this to be everything that is scalable tech in healthcare, so covering next generation diagnostics, breakthrough smart devices, a lot of AI, a lot of digital health platforms, and a lot of software. And all that is for creating sustainable impact in the global health arena.
Great. Thank you, Scarlett. Turning to Mr. Shigeru Handa from AAIC Investment.
Thank you, Shibusawa-san. Good morning, everyone. My name is Shigeru Handa. I'm the director of AIC Investment. We are living in a world where we have different values and the approaches, but we live and die, and we want to be healthy. And health is very much data-driven, right? And AI can be very effective in this field. As AIC, we manage venture capitals, investing in early-stage African startups. And we invest tech-enabled startups like telemedicine, pharmacy, DX, but also we invest in the brick-and-mortar business, like local manufacturing companies or dialysis service providers, because that's where the more of the job creation can be made. And we invested about 40 startups across Africa, and the 30 startups under the portfolio companies managed to achieve some business partnership or co-investment from the Japanese companies. The reason why we are promoting this is that creating this kind of partnership will help the startups in scaling up their business, and that will lead to the exit opportunities. We are in the financial space, aiming the financial return, but we want to have the co-creation with the startups together with all those stakeholders, and we want to be a catalyst. Thank you.
Okay, thank you very much. And finally, Ms. Saeda Makimoto from the Japan International Cooperation Agency, JICA.
Thank you, Shibusawa-san. Good morning, everyone. I'm Saeda Makimoto, Senior Deputy Director General of Human Development Department of JICA. My department is in charge of government-to-government cooperation. And JICA is a bilateral development agency, primarily working through such a government-to-government cooperation. In the health sector, we focus has been strengthening comprehensive health system by combining human resource development, facility development, and institutional development. And our ultimate goal is to help achieve resilient, equitable, and sustainable universal health coverage in low and middle income countries. JICA has another function that is private sector financing investment. We engage in impact investing, supporting private companies that are tackling development challenges in healthcare and other sectors. By utilizing public cooperation and private finance, JICA offers a variety of schemes to promote co-creation of solutions and innovation to accelerate inclusive and sustainable development. Thank you very much.
Okay, thank you so much. So you can see that we have 2 private sector funds and 1 government agency in development cooperation. And I think this is this is a common characteristic I think we find in the global health sector for the lower middle income countries. If it's just in the health industry in the developed countries, I mean, the financing and that comes a bit more naturally. But for the lower middle income countries, getting the government involved in a public-private sector partnership, I think, is very important for moving this forward. So that's why we asked these members to be on the panel today. So, Scarlett, initially going to you, you mentioned that you're a tech fund in health. At the same time, impact. So how do you measure, how do you manage the impact side of the equation? The financial side, we get it. You put money in, you get more money out later. But how about the impact side?
Yeah, so very good question. So the question around how do we actually connect this all together and actually generate impact is a crucial one that we ask ourselves. And this really goes back into the problems that we're trying to solve within the global health arena. And from our perspective, we're very much focused on three major problems. I'll go into this and talk about how tech can actually help with this. So number one, we have an access problem within health. And 54% of the global population don't have access to quality healthcare. The second problem is that we have an aging and a disease problem. So people are getting older and also getting sicker. Not just getting older and sicker, but even as young people, sometimes we're getting sicker as well. And the disease mix is now really, going from, transforming from infectious diseases to now much more chronic in nature. And the third problem that we're dealing with is that we have a resource problem. So we don't have enough hospitals, nurses, clinics, you name it, we just don't have enough. So, but with all that, the good thing is that we do have two things which are going for us. So the number one thing is that from a technology front, when you look at the advance of internet, data, compute, sensors, and most recently, AI, and this generation of AI, this is all really helping with how do we do things from a technical perspective. And the second thing that helps us is that there is a mindset shift in the sense that consumers care more about their health, governments care more about health, especially post-COVID, corporates, you name it, there is a mindset shift that is going on. So when we look at traditional healthcare, we think that traditional healthcare is very much sick care focused, which involves you get ill and you see a doctor and you're given some medicine. But when we think about healthcare, we think that there should be health and there should be care. And so as a fund, we actually really very much invest in this whole spectrum from health to sick care in the middle to also providing care, long-term care. And all this is actually tied together by using technology. Because previously, it actually wasn't really possible before by the traditional ways of looking at this. And now with tech, we can actually put in sensors, we can put in platforms, so we can put in a lot of these along the way. And this is where we can now use scalable ways to then create impact. And this is actually the secret sauce of being able to, as a small fund, being able to impact now more than 25 million lives through the 33 very early stage investments, because we see that high potential, we see that scalability behind the technology to then actually create the impact.
Great, wonderful. And what geographic regions are you involved in your investments?
So we're a global fund,
Okay.
and we have now invested literally into 6 different continents.
6 different continents. Okay,
Yes.
wow. Okay, impressive. Thank you so much. Okay, now let me turn to Handa-san because he's focused on Africa, and the reason why Africa, in 2050, 4 out of 1 people in our planet will be Africans, and most of them very, 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 very young. So a lot of potential there, but at the same time, increasing population means there's lots of problems and issues as well. So turning over to you, Handa-san, what is your angle in impacting or investment into Africa?
Thank you very much, Shibusawa-san. I think, as Scarlett mentioned, there are a couple of challenges, but which are quite similar in the African continent. And what I would like to say it's more of the, let's say, driven and demand-driven kind of the investment space. In Africa, we have the shortage of doctors, even radiologists. There are a lot of shortage. And that's the issue of the access. And there is the fragmented market. If you look at even pharmacies, like thousands or 10,000 pharmacies, like it's not really becoming the modern chains. That means there are a lot of different channels, and at the end of reaching that patients, you never know the medicines are legitimate or not. And the price can be even higher. And the third one would be the local, let's say, manufacturing capacity. In Africa, let's say 90% of vaccine is imported. Even like in medical devices, 80% is imported from the India, China, different regions. So there are a lot of potentials where we can come in to support those healthcare ecosystem. And for example, when it comes to the shortage of the doctors, we invested in one startup which is Lology, and in Egypt, they are building the teleradiology platform. And so they are connecting between the hospitals and the radiologists. Radiologists can be sitting in Cairo, but the hospitals can be in Kenya. Right? And it used to take more than a couple of days. Sometimes in the rural areas, it could take 1 week to deliver the report. Now, for X-ray, it can be delivered within 60 minutes. So that kind of the shortage become the business opportunities, and we also promote the collaboration. So that teleradio platform is now collaborating with the Japanese manufacturers, right? So that AI, they also have the AI screening business. So Lologit's platform can be incorporated into the medical manufacturing company's machine and delivered to the where there is a shortage of the radiologist. And we are also kind of making the MOU between those startups and, for example, the Hyo University to advance the AI. They have the data. In Japan, there are some challenges in accessing the data, but there is the AI more advanced academic research. So collaborating between the academic side and also the, let's say, clinical application in Africa, then that will create the more impact on the ground. Tech is very, very important, but at the same time, only tech will not be able to deliver the services on the ground. So those startups, they are not only relying on the tech, they become the hybrid. So it has to be locally led, locally oriented, has to be connected with the hospitals, clinics, understanding the medical procedures, clinical applications to maximize the impact. So there are a lot of areas, and identify where would be the good point to push from the Japanese impact investors' point of view, and bringing the Japanese medical corporations so that we can co-create the values to support the university healthcare coverage or the advancing the medical healthcare ecosystem in Africa. Thank you.
Thank you so much. By the way, who's been to Africa before? Oh, good, decent amount. Thank you so much. Like we talk about health for global health, like into Africa, we talk about access to medicine and all these conferences and boardrooms. So when you're actually on the ground, and I was in Ghana 2 years ago visiting a site on this dirt road, 6 hours, just bouncing around to go get to the site, and that's when you really get the access part, the importance of that access. And JICA actually has been in Africa for how many years now? It's maybe over 50, 60 years or something, and with lots of projects on site all over Africa. And the importance about JICA, I believe, is because not the traditional ODA, but this year the JICA law was changed, which enables them to use more catalytic capital to mobilize private sector investment into the healthcare and other areas as well. So. Any insights on the changes on the JICA law and how that would enable JICA to be more proactive in promoting healthcare investments?
Thank you, Shibusawa-san, for introducing JICA's new scheme. As a nature, private investors request financial viability, and the financial institution needs assurance of repayment. Then, as a result, private finance tend to concentrate in low-risk, high-return areas, often relying on proven track records. So we face a bottleneck at the public development side has or the society have a bottleneck for investment in high impact but riskier or less established sectors, such as health. To overcome this, JICA is introducing new financial tools following a revision of JICA Act in April this year. This reform has some key pillars, such as diversification of funding source, including long-term borrowing from non-government entities, or introduction of results-based private sector financing when loan terms are linked to development outcome. But our early new tool is, as Shibusawa mentioned, we provide, we invest in junior tranche when the project has or funds with multiple tranche, which absorbs the first loss, thereby improving the risk-return balance and attracting private capital to senior tranche. In another case, JICA can act as an anchor investor in funds, targeting sectors with high impact but limited financing history, helping to reduce perceived risk. One example, not in health sector, but one example is our investment in the Persistent Africa Climate Venture Fund, which supports innovative business tackling climate change and youth employment. JICA's catalytic investment in riskiest tranche helped unlock private capital for these critical sectors. And not as a new tool, but we also launched IDEA initiative, Impact Investing for Development of Emerging Africa at TICAD, focusing 4 areas and aiming to mobilize $1.5 billion by next TICAD 10, 3 years later. In the private sector financing investment, health sector was not the priority area in the, till now. But in this initiative, health was picked up as a priority area, so that combining the conventional private sector financing and the new tool, we can we can function more catalytic actors as we can play the role of a catalytic actor. Thank you very much.
Okay, thank you very much. JICA has done a lot of on-grounds work and they have done very much important work, but I guess in terms of financial risk, it's been a very conservative institution. So it's really a big paradigm shift when you start hearing words like first loss out of JICA. So we're at this very important, interesting juncture, I believe, in using development budget to induce more private sector investment. Okay, now we made the first round and we got a little bit of time left, and this is about tech. But I think tech is only as good as the data, and we talked about data as, you know, and how do you come in terms of the quality, not just the quality, but for a lot of the data that's on the ground, let's say in Africa or some, you know, South Asia, it's not just a matter of picking up the data from your personal computer terminal, I believe. So how do you come in terms with the data part of the equation? The financial data, it's probably more transparent, but especially the impact part of the data. So anybody can just jump in.
Okay, so I'll start. This touches upon a really important topic, which is impact measurement and impact reporting. And it's something that we take very seriously because it's important to actually put in the measurement part from the very beginning. So when we look for companies, we look for companies with intention, so real intention for impact. And as they agree, then even as we sign the documents to invest, we put in a clear side letter that says you will be conducting all these impact reporting to us going forward. And we have monthly reporting, quarterly reporting, and for the impact part, we have a Verge reporting form, which includes 5 different categories and 17 different metrics. And for these metrics, they go in very details, but the commonality between them is that at the very minimum, we are measuring the number of lives touched. So this is a common denominator. And in addition to that, we asked the startups and the deal team within Verge to pick the ones out of the 17 sectors to really focus on. And that will be the right way kind of going forward. And at the same time, it's important not to just take the data as is, but also ask ourselves, how can we actually double check on some of these numbers? So, for example, in one of our investments, we just had an exit in the fund where it's an AI platform company that was acquired by an AI-listed company. And for this company, we also go into the App Store to check, for example, how many downloads are there, right? How many users, how many reviews, right? What can we see from internal data where we can say, okay, we can also match some of these. But the important thing is to ask for that consistent reporting from the very beginning and then enforce that going forward.
Thank you. I think, Scarlett, you covered a lot. And one thing I would add is let's say, try to get the data closer to the users and patients. For example, when we invest in the pharmaceutical industries and also the supply chains, we used to be rely on the more data from the distributors, wholesalers, instead of going to the clinics or the pharmacies. But in Africa, for example, when you feel something bad or feel sick, then first point of contact is the pharmacies. So if you have a post data from the pharmacy chains, that will create more accuracy on the data rather than rely on the different channels of the data. So as Scarlett mentioned, there are a lot of data. We measure by efficiency, time, and also the effectiveness, mortality rate, all those. But we are also trying to see grasp the startups, having the data closer enough to the on the ground so that the accuracy can be improved. Thank you.
Okay, thank you. From JICA's standpoint, which is a government agency, when you make investments, usually private sector investments, if you have financial return, you're satisfied. But obviously, as a government, you're not looking just for financial return, but the use of that capital to have impact. And so, when you're currently initiating the investments in private sector, what is your requirements on the impact side?
Thank you very much. Yes. The JICA is working for the development, sustainable or inclusive development of the partner countries. So for the private financiers, private investors, we would like to ask the perspective of inclusiveness, not only as a measurement that we can count the number of patients the service covered, but that we want to have more focus on equity, on inclusiveness. So sometimes it is a very difficult point to have consensus that maybe our looking our viewpoint is a little bit different. So, but the discussion and understanding total picture of that area is quite important. And from the government perspective, to grasp the area regional situation and have a more effective and efficient government services, the information from the private sector is also very important because their service is increasing, expanding, and the government service monitoring is not capturing the total picture. So such a more dialogue and information sharing with such accurate and on-the-ground data is quite important.
Okay, thank you. We have about 5 minutes left, but I'm going to ask a difficult question. Because, I mean, I'm involved in global health investment as well. But in the end, it's the number of lives saved. And if you save lives, they can fulfill a better life for financial return for their household. And we get that part, right? So that's the ultimate goal. But as an investor, you're investing in company A, which might be in pharmaceutical, company B, which might be in diagnostics, company C, which might be in education. And what usually you're measuring is the output of those operations. And hopefully in the end, it all comes together to save lives. And so when we talk about impact a lot, but what are we actually measuring is more of the output part of the activity rather than the final impact, because impact is very, very long term. How do you come in terms with that sort of gap in the information, gap in the linearity, the direct impact you have from your investment? The financial return is very important. It's easy because it's that unit. But how do you come in terms with that? You said that I could ask anything, as I did.
Yes, absolutely. So I would perhaps start sharing by saying that not every healthcare investment is actually impactful. So when we look at, even though there are a lot of sectors out there, and we can say, yes, this is all very good, but because we have limited capital, and because we're going for the most capital efficient ways to actually create impact, and we have to choose. So every time as Verge, we have an impact assessment that we put forth first, before we even look into the details of due diligence and how is this going to produce the financial returns. Because we as investors, we all have choices, right? Not saying anything bad at all, actually, about biotech. Not saying that, but we feel that our impact as a biotech investor would be extremely limited, where you could be putting in hundreds of million or even up to 1 point something billion. Wait 10 years sometimes, and it could go to zero or not, or it could be a huge drug. But the drug could be costing $100,000 per year to actually take. But for us, we just focus on how can we use our very limited capital to then scale it into a way where we can put it into native, or sometimes we call these frugal innovations, so that they can actually go a very, very long way. So I think as an impact investor, we think very much about where we actually put in the money to generate the upside in the impact in a very significant kind of way.
Wanda-san, do you have any?
Yeah, I think just capital efficiency is very important. So we kind of focus on the output level, and looking at the outcome, it's kind of having a lot of differences.
Right.
But we do have two approaches where we connect the dots. For example, we connect the let's say healthcare companies, like medical device companies, with the logistics companies or the financial institutions, so that the outcome can be, but we will not be able to measure, but at least we can connect the dots for the different sectors. And second one is, even in the healthcare ecosystem, we invest in, for example, primary care services. And also we invest in the specialized services, dialysis, maternity. So we are gathering, having the round table. And then the primary care, that's the point of contact. And then if there is some diagnosis issues, then that will be referred to our diagnosis imaging center, or if they have a kidney disease, go to the our dialysis service providers. So we are also trying to reach out as a preventive measures, and if there is some kind of the issues, then refer to our ecosystem. And hopefully that will kind of create the more outcome level. But when it comes to the financial returns and the financial investment, it's very difficult to measure, and we focus on still like output level, and hoping that that will create the impact on the outcome level as well.
Okay, very good. Thank you very much. So, any last words from JICA in terms of what does success look like for JICA to mobilize more private sector capital through your new program? What would you say success will look like?
Yeah, thank you very much. JICA has been working with private companies a lot, for example, startups in Japan and local community. And they have a lot of good seeds, and we support some trial or pilot. But it's not easy to go to scale up. So as already mentioned, the thinking about the scalability from the first, and to scale up the communication between government or development agency like JICA is also maybe important to find out the good pathway. And we should not stick on the very short-term output or outcome, but also to think about long-term impact. So there are a lot of things, but such a dialogue is very important, and human resource development on the ground is important. Thank you very much.
Okay, well, thank you very much. So I need to be closing this session. Why I believe global health is important is the fact that we often talk about save the planet, which is very important. In the saving the planet, actually, a lot of the investment, we look at one number, which is called the CO2 equivalent. And if you do good, do bad, you look at that number. For health, there's so many different metrics. It's very, very complex. But trying to find that common language, even with the health sector, is a challenge. But I believe in the end, when we say save the planet, yeah, I get that. But I believe the planet will be around for a long, 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 long time after we're all gone. And so me, I think it's more about what do we think about saving the people on the planet, which includes, I think the term inclusivity was used, right? There are a lot of people being left behind, and when people are left behind, they get angry, and when they get angry, a lot of nasty things happen. And so in the end, I think that our common goal, what success looks like for all of us, I think, is how do we save the people on the planet. So thank you very much, and please a round of applause for our wonderful panel. Thank you.